Monkeypox. Monkeypox is a rare viral disease that occurs primarily in remote parts of Central and West Africa, near tropical rainforests. It is caused by the monkeypox virus, which belongs to the same family of viruses as smallpox. The disease was first identified in 1958 when outbreaks of a pox-like disease occurred in monkeys kept for research. The first human case of monkeypox was reported in 1970 in the Democratic Republic of the Congo. The disease is spread to people from animals, primarily rodents and monkeys, through bites or direct contact with bodily fluids. It can also be transmitted between humans through close contact with infected respiratory secretions, bodily fluids, or contaminated materials such as bedding or clothing. Monkeypox is caused by the monkeypox virus, which is a member of the orthopox virus genus and is related to the viruses that cause smallpox and cowpox. The virus is thought to be endemic, naturally occurring, in remote parts of Central and West Africa, where it is carried by animals such as rodents and monkeys. Human infections occur when people come into contact with infected animals, animal products, or materials contaminated with the virus. The virus can be transmitted through bites or scratches from infected animals, as well as through contact with bodily fluids, such as blood, urine, or respiratory secretions. Human-to-human transmission can occur through close contact with infected individuals, including contact with bodily fluids, respiratory secretions, or contaminated materials such as bedding or clothing. The virus can also be transmitted through aerosol droplets generated during certain medical procedures, such as intubation or bronchoscopy. While monkeypox is a rare disease, outbreaks have occurred sporadically in Africa, and there have been isolated cases reported outside of Africa, including in the United States, United Kingdom, and Israel. The symptoms of monkeypox are similar to those of smallpox, but generally milder. The disease usually begins with fever, headache, muscle aches, and exhaustion, followed by a rash. The rash often starts on the face then spreads to other parts of the body. Lesions progress to pustules and then scab over and fall off after 2 to 4 weeks. Monkeypox can be a severe disease in some people, particularly those with weakened immune systems. The symptoms of monkeypox typically develop within 5 to 21 days after infection with the virus. They may include fever, headache, muscle aches, backache, swollen lymph nodes, chills, exhaustion, a rash that usually begins on the face and then spreads to other parts of the body, including the palms of the hands and soles of the feet. General feeling of discomfort or uneasiness, malaise. In severe cases, monkeypox can cause complications such as pneumonia, meningitis, and encephalitis. The severity of the disease can vary depending on various factors, including age, overall health, and immune status of the infected person. If you are experiencing symptoms of monkeypox or have been in close contact with someone who has been diagnosed with the disease, it is important to seek medical attention immediately. Early diagnosis and treatment can help prevent complications and improve outcomes. There is no specific treatment for monkeypox, and the management of the disease is mainly supportive. Treatment focuses on alleviating symptoms, preventing complications, and supporting the body's natural immune response. Treatment options may include antiviral drugs. Some antiviral drugs, such as cidofovir and acyclovir, have been used to treat monkeypox, but their effectiveness is not well established. Supportive care. This may include the use of pain relievers, such as acetaminophen or ibuprofen, to relieve fever and pain. Hydration, rest, and good nutrition can also help support the body's natural immune response. Vaccination. The smallpox vaccine may provide some protection against monkeypox, but it is not specifically designed for this virus. The vaccine is no longer routinely given because smallpox has been eradicated. Infection control measures. People with monkeypox should be isolated and treated with infection control measures to prevent the spread of the disease to others. Prevention measures for monkeypox include avoiding contact with wild animals. The virus that causes monkeypox is carried by animals, primarily rodents and monkeys. To prevent infection, it is important to avoid contact with wild animals, including hunting or eating wild game. Proper hand hygiene. Frequent hand washing with soap and water, or using alcohol-based hand sanitizers, can help prevent the spread of the virus. Using protective clothing and equipment. People who work with animals or who are at risk of exposure to the virus should wear protective clothing, such as gloves, gowns, and masks. Avoiding close contact with infected people. Monkeypox can be transmitted between humans through close contact with infected respiratory secretions, bodily fluids, or contaminated materials such as bedding or clothing. Avoid close contact with infected people to prevent transmission. Quarantine. People who have been exposed to monkeypox or who are infected with the virus should be isolated and treated with infection control measures to prevent the spread of the disease to others. If you are traveling to areas where monkeypox is known to occur, it is important to take appropriate precautions to avoid exposure to the virus. Consult with a healthcare provider or a travel medicine specialist for advice on how to protect yourself from monkeypox and other travel-related illnesses.